Most people become sexually active at an average age of 18. However, in the most recent years, the average age is lowering, increasing the rate of teenage pregnancy. There are many factors contributing to this increase, one of which being the lack of available and affordable contraceptives. We've all had to take a health class in high school where we were taught about sexual education and the many risks that come with being sexually active. However, the cost to prevent these risks were never taught, which leads us to our topic today on why these contraceptives should be offered free, beginning in high school. Let's begin by focusing on the most common types of contraceptives, which include birth control and condoms. First, birth control will not only help prevent unwanted pregnancies, it would also improve women's health, reducing the risk of ovarian cancer and endometrial cancer, and would also regulate menstrual cycles caused by PCOS, which can lead to infertility in women. Those are only a few of the many advantages that taking birth control can have on women. Condoms, on the other hand, apart from being 98% effective on preventing pregnancy, can also reduce the risk of contracting any sexually transmitted disease or infection. Therefore, a big advantage on having free birth control and condoms available would help aid in both men and women's health because it would minimize a large portion of the population who is infected with AIDS and HIV. In more recent years, teenage pregnancy has become a big issue, where we even have television shows based on this cause. However, these TV shows are meant for entertainment, and it fails to discuss the seriousness of the issue. Statistics show that one of the main leading causes of death in adolescent girls between ages of 15 to 19 are caused by complications during pregnancy and childbirth. This is all caused due to unintended pregnancies because of the lack of available contraceptives without the parents' consent. Most girls that become pregnant at a young age are scared to speak up when they are sexually active, and in fear of getting reprimanded by their parents or guardians turn out pregnant and they hide it, which leads to more issues in the pregnancy, especially in third world countries where they have less resources available. Since these are unintended pregnancy and usually occur at a young age, these girls don't want to keep their newborn babies, and after they birth their babies, they turn to adoption and foster care, which leads to another major issue in the United States with the outstanding cases of children in our foster system that we have and the number of cases of child abuse that come with it. The last reason on why contraceptives should be free or at least completely covered by health insurance is because the cost of labor and delivery for unplanned pregnancies is extremely expensive, especially if it is covered through public insurance. Statistics show that public insurance covers 68% of the 1.5 million births that were planned versus the 38% that were planned. Overall, the government spent $21 billion on unintended pregnancies that year, or about $336 for every woman between the ages of 15 and 44. If these women were offered any type of free or affordable contraceptives, a large portion of these costs could have been avoided or minimized and not had to come out of our taxpayers' dollars. In conclusion, many people are against free contraceptives based on their religious beliefs. However, having free contraceptives available to anyone beginning in high schools, colleges, and all clinics may be a long run, but its benefits outweigh the negatives, where this should be a more public discussion. It would decrease the number of teen pregnancies all over the world, help protect both men and women's health against contracting any sexually transmitted diseases or infections, and also it would minimize the amount of money directed towards unplanned pregnancies. So what steps are you willing to take to help this cause?